looking at the 2022 hospital national patient safety goals because it ties in with your QI. All right? You're going to want to look at these goals for your QI assignment. So these change year to year. That's why there's a date on there. Jacob will come in and we'll look at, anything from my clinical group here? Come on, you could admit it. Jacob was just at Charlotte Huntington Hospital. The state was there the week before. We were lucky enough to enjoy that. And then Jacob came to Charlotte Huntington Hospital. What were they looking at?
Jacob was at Waterbury too.
Yeah, they're in the area, so you're going to see them at all of the we'll be seeing them in St. Mary's next. Because once they're in the area, they're going to go to each hospital. But they do make yearly visits, right? And after COVID, understandable, right? But do you guys get to see my clinical group or Waterbury Hospital? We had Jacob in the building. Did you see what they were looking at?
Safety.
They were looking at the National Patient Safety Goals, okay? So you want to be sure, so the reason we asked you to do the quality improvement assignment is because we want you guys looking at these in order to be prepared and help the hospital prepare for Jacob's visits, right? So we had a big bulletin board. I was kind of proud of our unit, right? They had this big bulletin board about all of their safety initiatives with data. So they were all looking at it as we're running through trying to get our stuff done, right? But it was impressive. And if you look on your units at all hospitals, I'm sure you will see something regarding National Patient Safety Goals, okay? And what the unit is doing, what their initiatives are. So the first one, they tightened these up a little bit this year, and I kind of like it. The first one is to identify patients correctly. And you guys do that. You use 2 ways to identify the patients. Patient's name and date of birth, a medical record number, and it's done to ensure that the correct medication and treatment is given to the patient. Improve staff communication. You want to get the results to the right staff person on time. You'll see your unit secretaries, as soon as they get some lab work, immediately texting or talking to the nurses so that information goes on to the doctor in charge, and then we can start our treatment. Take extra care with medication, use medication safely. Before a procedure, you want to label everything that are not labeled. For example, med syringes, cups, and basins. Do this in an area where the medicines and supplies are set up. Now, we saw this in action at Charlotte. You guys don't have to write this. I have a link to the National Patient Safety Goals. This is just a copy. So I want you to just think about this, right? We saw this at Charlotte Huntington Hospital. We were covering insulins, right? You guys talk about it. Come on. Go. What happened when Jacob was there?
Like,
I'm going to give you the mic if you don't.
no, I really don't want
I'm so threatening. What happened when Jacob was there in relationship to medications and insulin? Oops. Go ahead. You're good. You got this.
I don't know, just
Anybody? You guys are too busy thinking about your meds and your patient, right? They literally set up an insulin drawing station. They ran through, and you guys have all seen this when Jacob comes in, right? Everything is beautiful. It's absolutely beautiful, right? All the cabinets are locked, right? All the cards are locked. It's a beautiful environment, right? When Jacob or the state is there. Luckily, the state was there beforehand. They went through and they looked at every single insulin bottle on the unit before Jacob even hit the floor. There was a big announcement, Jacob, please welcome Jacob to the Charlotte Huntington Hospital, right? They went, and it's not, it is kind of funny in a set, and I know I'm kind of joking about it, but it's really not. If we did what we were supposed to be doing all the time, we wouldn't have to worry about this. And it's all for patient safety, right? So, now I'm holding the mic, right? So they ran around, they labeled all the insulins, they threw the ones out that were outdated, that were on the units being used. They set up an insulin drawing station specifically to draw up your insulin. So you had to go to the station. You see the nurses all the time in the right? Because they're trying to get their work done. But according to the 2022 safety rules, you're supposed to have a specific area for that stuff. Why do you think? Yeah, bleeding, and they're high-risk medications. I think I talked to you on the voiceover about Dennis Quaid and his twins, and they got the wrong dose of heparin. There's a lot of different dosages of heparin. You could run into big trouble. So you want to take care of, any medication that is in the patient's blood. Record and pass along information about patient's medications, find out what medication the patient is taking, compare those medications to the new medications given to the patient. What is that called?
Reconciliation.
Medication reconciliation. It's done when they come into the hospital to make sure they're taking what they're supposed to be taking outside and not taking it if it affects the patient, right? But also when they leave. Med-reconciliation is done. Tell the patient it's important for them to bring an updated list with them. And give your patient information about the medicines they need to take. A lot of the patients I'm seeing, more so even now, know their meds very well. They'll be asking you, what's this? Why is this pill this color? Those kind of things. That's excellent. It's so exciting when you go in there and you're like, here's your med, right? This is what you do. Do you know why you're taking it? Right? And this is because of these initiatives. And good nurses who are telling them why they're taking their medications. Use safety alarms, make improvements to ensure that the alarms on medical equipment are heard and responded to on time. Prevent infection, hand cleaning. Identify safety risks, the exemplar is for suicide. Prevent mistakes in surgery. This is what we're going to talk about today. We're going to do a case study on today. Make sure that the correct surgery is done on the correct patient at the correct place on the patient's body. Mark the correct place on the patient's body where the surgery is to be done. Pause before the surgery and make sure that no mistakes are being made. Huge. You'd be surprised at the number. I pulled a case study from the INH, and it's an older case study it is an older case study, and they talk about how many wrong-sided surgeries are not being reported still. But there are a big number of them that are still occurring. Even with all of these safety concerns, it's a big deal. It was an older stuff. It was an older. So your quality improvement assignment. It's due on October, the step one, just step one. You're doing it as a team. It's due on September 1st. This is all on Blackboard in the whole thing, okay? Due on October 13th is for step one, all right? In your group, you're gonna complete the completed quality, national patient safety goals, safety initiative, evidence-based practice. Yeah, you're gonna be looking at your topics with your clinical instructor. You're gonna be wanting to pick one, and then you need to write up on it. Okay? I swear to God, it's on Blackboard. I swear to God, that's where I put it. That's where I pulled it from. I know you guys like pictures. That's fine.
I don't think I see it.
We can't find it.
It's there. I promise you. It might be hidden. You know why? Because Unit 3 is hidden. It's gonna open up on Thursday. All right. So that's why you're taking the picture. Now I got it. It's there. You'll be able to see it. Is it open? She's probably.
Oh, it's in Unit 3.
Yeah. It's in Unit 3. Yeah, because now we're starting Unit 3 after Unit 2 exam. Yeah. Well, no, this is good because we need to know that you know where it is, right? Especially for Dr. George's lecture on Thursday, class on Thursday. So now you're gonna be you have the extra time, right? Tuesday and Wednesday is extra time as far as I'm concerned, right? But if you're in clinical, you're talking with your group about the topic on the national patient safety goals that you want to be doing, you might want to be doing. You're looking at the initiatives that they have on the unit. Okay? Make sense? Everybody get the picture? And again, I promise you Dr. George is going to talk about this on Thursday. So case study. We want to talk about wrong site errors and list ways to prevent wrong site errors. And this is truly a class discussion, okay? Can you guys that? I just the front, can you read it? That's not helping.
How'd you do on the test?
I think I got like a 70.
Really?
I think so. I got a lot of like the
Does that help?
decimal ones and
I changed
the
my
brain ones.
answers.
All right, so I'm
It's
not
funny. I
sure
think
you
I
can
changed
study
like
and then
3.
I
I
want you
changed
to
2
tell me
of them
what
to
the
the right
problem
answer
is.
and one of them the wrong one.
Heard any reaction on this? So it doesn't believe it, or?
No. I said, when they die, just getting told to get it.
And that's a funny sticker, that's a funny meme, or, right, it's a meme. I can say something to like, Mom, nobody's sending us memes. Right? But it's a funny thing, because but did they die, but it's really scary, because they could have died. Right, you put a chest tube into a lung that doesn't need it, and the other lung doesn't get, for a pneumothorax, you guys did this material, right? For a pneumothorax, the patient could have died. They wound up replacing it, right? What happened? Can we talk about what happened here? Mislabel on the x-ray, what else?
But doesn't the guy have to listen to your lungs before he sticks a chest tube in there?
You got it. You got it, right? So he did a quick assessment, he already has in his head, because there was a mistake. We didn't even talk about the mistake at the radiology, right? So the radiologist or person who did the chest x-ray made the error and put it on the wrong side, right? He read probably the report, didn't even look at the x-ray, right? Didn't look at, what else could have prevented him from, because we're kind of, you're answering the questions that I'm gonna put up in a minute anyway, right? What else could have prevented this from happening? So the problem was an x-ray to begin with, right? Listen to lung sounds, absolutely did a complete physical assessment, what else? Could have prevented it? Talk to the nurse, absolutely would have taken care of that, ask her assistants, right? We set up the chest tubes anyway, go talk to the nurse would have said, hey, you're on the wrong side, buddy, right?
Yeah.
What else do you think could have happened? You could have been done.
Ask the patient.
Yeah.
Possibly, if you did a good physical examination, it was a car accident, right? Or an accident, right?
It says what?
One
Chest
chest
trauma.
trauma, I don't know why I think car, right? But you would have saw some bruises, so a very good physical assessment. What else do you want to look at besides the physical assessment? Do, the chest x-ray, make sure the chest x-rays don't okay, and if you have any, like, look at the actual chest x-ray, right? Make sure that's okay, and then if it's not, what else to tell you that you're on the wrong side? Yes?
Well, you're gonna be able to see chest rise on the good side.
Yes.
And then.
Symptoms, that's another, yes, yeah, absolutely, good.
What about
Good
the,
job, yeah.
is this the one with the tracheal deviation? Or
Oh, yeah.
where it, no, okay.
For a pneumothorax?
Yeah, then,
No, I don't.
okay.
That's our attention.
Oh, that's right,
Pneumothorax,
you're right,
yeah.
yep.
I'm like, what? I haven't thought that in a while, but I'm trying to, yeah. Thank you for, getting
Yeah.
attention to
Thank you.
Right? What else could have been looked at prior to having this chest tube put in the wrong place? What do you hear in the morning when you listen to report? Communication all the way. Communication with misplaced, with, wrong drawing x-ray, communication with the radiologist, putting it on the thing, all the way, right? But what else would have prevented, do you think? What do you think in the morning first thing in the report? Patient has a right-sided pneumothorax, right? I'm going back to talking to the nurse, but still, look at the past medical history. Look at the chart completely. Do not, this is not something, this is a wrong-sided surgery. If you think about it, I know they put chest in at the bedside sometimes, but this is a wrong-sided surgery. And could have been a sentinel event. No joke, this guy's suing, right? Because he lived, but because he was able to live, but it could have been a death. It's not, So make sure you're checking, everything's being checked out. Here's the chest X-ray. This isn't the chest X-ray, but it was a chest X-ray in the case study. What in this chest X-ray makes? What could tell you? What factors do you think could tell you that you're in the wrong side as well if you actually look at the chest X-ray? Yes. Yes, right? You were in the aortic, right? Arch. What else? What else on this chest X-ray? If the resident looked at the chest X-ray. The coloring where?
I think it was the left side.
The left.
Where?
Like they put it on
Correct.
the right.
Okay.
On the
think.
bottom lower right lobe, right? Where it's pointing to the pneumothorax. There's the aortic arch right there. If we looked at the actual X-ray, you would be seeing, right? And it's tough. Why? Because you're doing it kind of, right? It's opposite when you're looking at it. When you're actually looking at the image, it's a little tough. But you still want to make sure you're looking at the image.
I'm sorry, what are the yellow lines pointing at?
The pneumothorax.
Okay. So that's just dead space?
Yes.
I never
Yes.
saw this on X-ray like
Yeah,
that.
and I'm not asking you to know X-rays, I'm just telling you, the point of this is what? Look at your data. Look at all of your data, and that would not have happened.
I don't see how that is different than the white stuff on the right side, on the left side.
It is.
Okay.
If when you're ready, I don't, right? I know it's a little, it's a little bit, there's more, yeah. Okay? All right. I'm gonna go to the left side too, don't say that, please. And I'm not asking you, I'm honestly not asking you to look at X-rays, but when you see the results, you do look at the X-rays all your instructors have asked you, what does the chest X-ray show or whatever, because I know you guys have had some of these patients, right? If you see a result written out that says it's on the left side, or it's on the right side and it's supposed to be on and you know it's on the left side because you listen to a report, you know the patient's past medical history, you could be one of the people that are like, aha, right? We come across these things in clinical, have we not? Medication-wise, everything. So if you're doing, the point of it is if you're doing these safety initiatives the way you're supposed to be doing it, and it goes back to talking about doing things all the time that way, doing the right way, doing JCO, National Patient Safety Goals, you're gonna be fine, right? It's a safety net. So what do you think? So we talked about the physical exam being important. We talked about the image, looking at the image or whatever. We talked about the patient history being important. It's how would you prioritize your line? What's the most important?
Assessment, or communication assessment.
Communication and your assessment. Doing that physical exam and hearing what you need to hear, right? To know you're where you're supposed to be. How could you have not done a physical exam?
And then taking your time, not taking a brief assessment, taking your time.
Well, that's part of I like that, Nicole, because you know what? That's part of the national safety goal to prevent a wrong side, right? Take your time, you're not just popping, this isn't light, this is very invasive, and a sentinel event, right? So that's good. What other sources of information could help localize the lesion? What other sources? Are there any other sources that could help besides the physical exam?
The nurse.
The nurse, thank you. What else?
The radiologist.
Clarifying with the radiologist, right? Because this was the tech that put updated on the wrong side. What else? There's other sources, right? What else? How about the guy who's in bed? It's always, you always talk to the patient, right? Now, he may, like, you know, he may have been, I don't know what happened there, but if someone's going over my right lung, right? And there's, I'm gonna turn, so you ask, even if, and there are some patients that will not say a thing, right? You know, patients, maybe there's a communication, concern, maybe it's a cultural thing where we don't question the doctor. There's a lot of reasons why people don't say anything, even for a chest tube, right? But if you talk to your patients. They're the greatest source there is, right? Okay. What else? What hospital systems are in place to minimize alongside radiology and surgical interventions? Anybody in the OR here? Time out, right? Time out just before surgery, time out when the patient's leaving the floor, a hospital checklist, what else? I want to ask a clarifying question. I'd like clarification. That's excellent verbiage, right? Because you don't want to be doing this, right? What else? Anybody send someone for a certain side surgery? They mark it with those markers, those pink, purple markers, right? They mark those, right? And I can tell you a story with, and Dr. Knight will even laugh at me about. He was, my patient was going down for a mastectomy. And the OR, I don't know if you guys know, but a lot of times the OR is like, let's go, we gotta get into the OR, it's an emergency, right? We don't like that, because that's when mistakes happen. You take your time, you slow down. So I had to bring so I brought the pen in, I did the checklist, I brought the pen in, I had the patient mark the breast, right? And he called up and he was yelling at me, where's this patient? I said, she needs to mark the breast. So, and he gave it to me, and we were pretty close when we were working together, right? Patient went downstairs, had the surgery, did fine, came back up, I recovered her. He came up and he apologized, because we don't rush, right? You don't rush that. What is the consequence? Always think it's always risk versus benefit, right? What is the consequence if I don't have her mark hospital protocol for national patient safety goals? The consequence is that other breast comes off. And it's already a big issue, right? Losing a limb or anything. So we don't play around. And he gave me a gift afterwards. He was like, Lisa, you were pretty good, you lose your cool, right? But, and I taught him a lesson. Not that, it's for the patient. I wasn't like, you know what I mean, at the time, but you gotta take your time. You can't play around. Ears are often hidden or suppressed for other reasons. How can this incident be used as a learning tool in the hospital?
We're just reviewing it like we just did now.
Yeah. Reviewing it, and what else? That's it. You have to go through it. So there's a debriefing. We talk about debriefing for a lot of things. There's definitely a debriefing on this with the hospital lawyer for that matter, because now they're cost control or whatever, right? Because this guy's gonna get not that you want to be paying for a misplaced, right? But he's definitely gonna have to do something about it, right? So what else can we do in the hospital? Yeah. New policies put in place, absolutely. He was a resident, right?
Yeah.
Where a resident can't do it without, the doctor signing off, or I co-sign off, you co-sign all the time, right? Students, resident can't, or a doctor's there, or something along those lines so that doesn't happen again. New policies, new review of policies, education all the way through. And the next question is kind of the same. How could you use this incident in positive ways? It's really the same answer, right? Just make sure that you're following through on there's education there. Questions? No? I have a couple announcements really quick, which I missed because I was like, where are they? I gotta get going. I'm afraid I'm not gonna have time. Okay, no, And the last one is there's an SGA meeting at 1:30
I
today.
hate that. I go upstairs for prayer.
Please
There's like
come,
never any
please
peace.
support. There's a student government meeting at 1:30 today. You do not have to